Dr. Lily Hughes is back with her final segment of 6 on hearing.
Hi, my name is Dr. Lily Hughes, and I'm a clinical audiologist at ENT and Audiology. We're a department of Rutland Regional and located on 69 Allen Street and also in East Dorset. I've done about 5 segments now on hearing and hearing loss. We've gone over how the ear works, how we test hearing, how we go about explaining that to a patient, and then also what treatment of hearing loss looks like for different parts of the ear. This last segment is going to focus on hearing aids specifically. I have so many patients come in who are very hesitant to talk about hearing aids, and rightfully so, because it's very confusing. There's a lot of media out there, there's a lot of confusion in pricing and what people need. There's unfortunately people who also retail hearing aids and take advantage of those consumers. So being on the state hearing aid advisory board myself, I've learned a lot about the federal regulations. Between the FDA and the FTC, I've come up with some basically education guidelines to guide all of you should you be interested in seeing what your baseline is, or if you're interested in going for a hearing aid appointment, you'll be prepared. So I'm going to start by explaining all of these, and hopefully that'll help you for your next appointment. All right, so number 1, know before you go. What kind of professional will you see? When you call this place, ask them, do you fit a wide range of styles and manufacturers? What kind of testing do you perform? Is it a screening or is it a full audiological evaluation? Do they bill insurance? Do they have an overview of their hearing aid program to give you? Do they provide medical clearance at their facility? Also, don't go alone. One of the most important steps that my patients take is to bring a spouse or a family member. 2 people really do remember better than 1, and they do hear better than 1. When you show up for the appointment, interview the provider. Is that person, what's their education basically? The value you get out of your hearing aid is based on the skills and ability. I remind everyone to shop for the provider, not the hearing aid price. There is a big difference. You could get fit with the best hearing aid in the world, but if they don't know what they're doing, you're not going to benefit. Have your hearing tested. This is kind of an obvious one, but in order to pick out the appropriate style and power of the hearing aid, we need to know what your hearing loss looks like. Take advantage of free education. At ENT and Audiology, we provide hearing aid education sessions to every patient that is a candidate for hearing aids. This is free, it's a consultation. We get to go over all the styles, features, brands, and price points to find what's right for you. Take advantage also of your trial period. Vermont law requires a 45-day trial period. This is absolutely required and very tentative. So if you are not doing well or you need to try something different, we can extend that. But this is your chance to experience these hearing aids in your world. You might have committed and put money down on this process, but you do have the availability to exchange or to return if it's just really not for you. Get it in writing. So when you purchase hearing aids, you should get a signed copy of your contract. It should specifically state the Vermont requirements for a 45-day trial period. It should state your price, the trial period, again, like I said, all the fees and the price of the hearing aid that you're paying for, as well as what your warranty period is. Ask your provider about auditory training. So hearing is one thing, listening is another. Some brains are going to need extra practice. You may be hearing well and meeting your targets with your hearing aids, but you also might need a little bit enhancement training. And then finally, paying the bill. From the 2012 Consumer Report, they warn that there may be a large markup on hearing aids purchased through commission-based providers, including large box stores and franchise private practices. Be very careful when offered deals or money off for your hearing aid purchase. Highballing should be considered for cars and retail items, not medical devices. So I really hope this helps you, get you more prepared to ask the right questions, and come down and see us anytime because we are very patient-centered and our audiologists are awesome.